Good morning, everyone. Andrew Douglas in the Action News 5 digital desk. Let's talk about health care changes for older Americans. They're going to be seeing some changes in 2023. Brand name drug prices, they've grown faster than general inflation now for more than a decade, meaning a growing number of patients have had to go without necessary medications. That's why AARP has been working hard to convince lawmakers to allow Medicare to negotiate prices with pharmaceutical companies, levy tax penalties on drug makers that raise prices more than inflation, and then cap Medicare Part D out-of-pocket costs. Let's talk about some of those changes for Medicare recipients right now with Lee Purvis, AARP's Senior Director of Healthcare Costs. Lee, good morning. Appreciate you being here. So let's talk about the changes that Medicare participants will be seeing this year.
Yeah, there are three really big changes that all Medicare beneficiaries should be aware of. Starting in January, recommended vaccines are now free for all Medicare beneficiaries. Also, Medicare beneficiaries who are in prescription drug plans will now have $35 cost sharing for their insulin. And another really big important change that you already mentioned is that drug companies will now be penalized if they increase their prices faster than inflation, which will hopefully discourage them from taking those big price increases that we've been seeing lately.
Okay, and how does this compare to 2022? I mean, you mentioned what we can expect in 2023. How does that compare with what we saw last year?
So last year, frankly, none of those protections were in place. People sometimes for vaccines were paying upwards of $100 as a cost sharing for their vaccines. And we also saw people who were taking insulin that were paying on average around $50 per month for their insulin, sometimes as much as $100 per month. So this change is a really important one because it's going to result in a lot of savings. And when it comes to those price increases, AARP has been reporting on prescription drug prices for a very long time. And the reality is nothing was in the system to stop drug companies from taking those big price increases, and now something is there because of this new law.
All right, well, let's talk about vaccines for Medicare beneficiaries this year. What's the change and what can they expect?
So previously, vaccines could be covered under your Medicare prescription drug plan. And depending on your plan and where you were in the benefits, sometimes you could have cost sharing of hundreds of dollars. And now that's going to stop. All recommended vaccines will now be available for free for Medicare beneficiaries. So that's going to hopefully reduce some obstacles that people may have had to getting the vaccines that they need.
We lost your audio.
Lee, can you hear me? I'm sorry.
I can. Thank you. You're back.
Okay. Yeah. So apologize for that. I was wondering if you could kind of give us some insight into people here in the Mid-South. Of course, we're in Tennessee, but we also cover Mississippi and Arkansas. Those people on Medicare that use insulin, how is that going to change in 2023?
So specific to Tennessee, there are about 83,000 people who are currently using insulin. So that is going to be a really big change for them because their cost sharing is now going to be hopefully greatly reduced down to $35 or potentially even less. And we know that there have been a lot of people who use insulin who have been facing really high out-of-pocket costs. So hopefully this change is going to take away kind of the struggles that people have been facing in terms of affording the medications that they need.
So let's talk about some of the other changes here. You're going through a lot of changes for older Americans, Medicaid, and or rather Medicare recipients. What about some other changes? When will we start to see those issues out-of-pocket prices? I know you mentioned a little bit off the top. Any other changes this year?
Yeah, there's some really big changes coming our way that will have a really big impact for a lot of people. The first is that Medicare is going to start reducing the amount that Medicare beneficiaries have to pay for their prescription drugs every year. Right now, there are some people who pay upwards of $10,000 for their prescription drugs when they're enrolled in a prescription drug plan. And by 2025, Medicare will limit the amount that people have to pay every year to $2,000. We know that more than 1 million people are paying more than that. So this is going to be a really big change for a very large number of people. And another really big important change is that Medicare is finally going to be allowed to negotiate the prices of popular prescription drugs. We're going to know the first 10 drugs that will be negotiated by the fall of this year, and the negotiated prices will become available in 2026. And that's not the end. There are going to be more drugs added every year, and we could see as many as 60 drugs with negotiated prices by 2030.
You know, a lot of our viewers are tuning in, trying to decipher some of these changes for 2023. Is there anything else you want to tell them, with regards to these changes? You've mentioned a lot already.
Yeah, this new law has an incredible number of provisions that are really going to help dramatically reduce prescription drug prices and costs for a lot of people. There are millions of people in this country who are on Medicare, and AARP is very well aware that many of them have been struggling with high prescription drug costs. And the provisions in this law are going to go a long way towards making sure that everyone has access to the drugs that they need.
Okay, and then I'm sure that there's a place online where people can go for more information, Lee. Where can people go to get this information you've talked about, and perhaps some other information as well?
People who want to learn more can go to aarp.org/rx.
Okay, all right. Well, listen, Lee Purvis, we really appreciate everything that you've said with regards to breaking down some of these changes for those older Americans. I'm sure that they're going to be thrilled with some of these changes you mentioned, and then where they can go, aarp.org, to get some more information on that. Thanks for your time this morning.
Thank you so much for having me.